Hi folks, I want to give you a tutorial about infections. A lot of us head into the backcountry and we want to stay in the backcountry and we might plan a 3 to 5 day trip. However, on day 1 or 2, something happens and we have a small injury. Maybe an abrasion on the forearm and elbow. We might have a cut on our hand from cutting something improperly with a knife. Whatever it is, we want to care for it immediately and well so that it doesn't get infected. However, some things do get infected, and we want to be able to recognize the signs and symptoms. So my friend Mr. Bear went hiking in Paria Canyon. How was your hike? Oh, he said it was awesome. Oh, but on day 1 he cut the bagel, and he was trying to find a flat surface and use his arm and cut himself, and then just threw a little bandage on it himself and never cared for it. So we have a little acronym called SHARP. It stands for swelling, heat, aches, red, and pus. So let's look at this injury and see if it meets those qualifications. Now it might be hard to see underneath the fur, but I can tell you, Mr. Bear, that's looking pretty swollen. Okay, does it hurt? He said it's tender. However, a lot of injuries that aren't infected are also tender. When I feel it, it feels warm. I can also touch the other arm to feel what that one is like, and that's not as warm. And it aches, so when he moves his arm, it's uncomfortable. It's a little red, kind of a little raised, and there's a little bit of white or clear pus. So this is a mild infection, and we want to care for this. Mr. Bear wants to stay on the trip. He says he is really excited. So what we're going to do is we're going to do some hot water soaks. I have this pot here. I boiled some water so it's purified. Then I let it cool down. And then I'm going to have Mr. Bear put his arm in that pot. 20 minutes, okay? So maybe you could put a podcast on or read a chapter of your book or something. And after 20 minutes, I would put a piece of gauze on it and then rewrap it. And then I would do this 3 times a day. So breakfast, lunch, and dinner are great times. And then injury and infection would need to get better for us to stay in the backcountry. So we can look at it in every day and be like, wow, it's getting better. And I have the other arm to look at to see what a normal arm looks like. And his signs and symptoms are going away. So we can stay. However, if Mr. Bear had a severe infection, we would see a lot different things here. It not only would be red, it would have red streaks to the heart. He would have a fever. If I checked his lymph nodes, they're probably swollen. He's got general malaise. His whole body aches. And he's just not feeling great. And the pus that's coming out of this is gross. It's green, it smells, it's yellow. So we would still do the same treatment for Mr. Bear, but we would do a rapid evac. Because at this point, it's systemic. It's through the whole body. And there's nothing more we can do in the field for him, so we want to bring him to higher definitive care so they can treat that infection. That is a rapid evac because a patient can die from a severe infection. So let's look at this on a chart. Okay. We have over here the clear. We have what a good injury is going to look like. Pink, clean, clear, no pain, warm, and tender. Here's that little acronym SHARP. It's got swelling, it's got heat, it aches, it's red, it's pus. And this is all centralized to the injury. When we go over here to severe in red, these things are throughout the whole body. So lymph nodes might be swollen. That swelling is not just on the injury, but the whole arm. Fever and hot. He has general malaise, that whole body ache, those red streaks, and it is gross. So as mentioned, treatment is 20-minute soaks 3 times a day. And it would be great if they were warm water soaks, but everyone may be in a different environment and you might have to modify. One common question people ask is, if the pot I have is pretty small and I can't fit my elbow in it, how do I soak it? Well, one thing you can think about is you can take a cravat or a bandana or even a t-shirt and cut it into strips and then put it in there, boil it to sanitize it, and then you can take this and put it on the injured area, and you can keep this warmer and keep switching those pieces. The other idea would be potentially to bring a Ziploc bag, a big one, so you can fill that Ziploc bag up with water, and you might be able to put your elbow or your foot in it. So remember, backcountry wilderness medicine is a lot about creativity once you know your principles. That's it. Don't forget to monitor for infection so you can prevent it.